Hi, my name is Jama. I'm a medical doctor and co-founder of Symptoma. Symptoma is a digital healthcare startup. So when you're listening from the US, then you may have to know the European culture because we are asking a lot where you come from. So I'm getting the question quite a lot as well. So my answer to that question, Jama, where you're coming from, my answer is, so my name is from Cambodia. My roots are from Afghanistan. I was born in Germany and raised there, and I am here in Austria since 17 years. So this is my answer from where I'm coming from and a little bit of backstory. So Symptoma, as I said, is a digital health assistant. Patients and doctors enter symptoms and they receive a list of causes sorted by probability. So we help patients to even uncover ultra rare diseases. We have invested 15 years in research and development and so far established the biggest disease database in the world with 20,000 conditions and billions of connections to symptoms, risk factors, and statistics. We have demonstrated the highest diagnostic accuracy rates in the market, as also proven in internal, external, and peer-reviewed studies. For instance, Pfizer compared 107 solutions worldwide and concluded Symptoma to be the best one and also published it. Symptoma is also the most used symptom checker worldwide, for instance, through integrations into big publisher portals, such as from Time or Funke. So we are reaching 10 million monthly active users and on a monthly basis. And so far we have delivered 500 million sessions. And if you have a little market understanding of our symptom checker market, I think the second biggest is about 25 million sessions or so. So there's quite a huge difference. Well, I think this is it. We are based in Austria. Our headquarters is lakeside in Attersee, near the Red Bull headquarters, only that our headquarters is cooler. We have two other offices, one in Vienna and one in Salzburg. In Vienna, we are really at the heart of healthcare in Austria. So we have a whole floor of a skyscraper where the Austrian Social Security is also. They are also our landlord and research partner. And I think and we are 70 people in the organization, 35 of which are employed in Austria, and the others are mainly medical doctors from other countries helping us to localize Symptoma. Symptoma is available in 36 different languages. Our vision: every patient deserves the right diagnosis and treatment. Our mission: we want to eliminate the guesswork from medicine by 2030. And our core values are lean, helpful, strong. Yeah, so first you have to decide where in the beautiful country of Austria you really want to reside and found your company. Because although Austria is small, the landscape is completely different from west to east and north to south. So most likely you are going to be in Vienna because it's the mainstream path. Although I can absolutely recommend the countryside, the lakeside and with the many mountains. However, so if you are in Vienna, the first go-to places and stakeholders are, for instance, the Health Hub Vienna. In it, as an incubator, the Vienna Business Agency, they help you setting everything up here and providing you a smooth transition. And then also you will quickly probably going to make yourself familiar with the funding agencies. So for instance, the Austrian business agency or the Austrian research promotion agency, because of course whatever capital you have you want to leverage, which is a really good thing to do here in Austria because the funding environment in Austria is quite positive towards startups. So Austria is quite unique regarding the digital healthcare. So first of all, you have an established electronic ecosystem with ALGA. So ALGA is an electronic personal records essentially for all citizens that have insurance, and it allows for doctors to tap to other reports of other doctors that have done any investigation on you. So it really helps as a basis. So you have the right infrastructure. What you do not have yet is to utilize the infrastructure in the right way. So we are still at the beginning of doing that. Otherwise, the citizens are getting more and more mature regarding the digital health aspects. I mean, we started out, I can tell you, 2006, we started with Symptoma. And back then, digital healthcare was nothing. So I don't even think that it really existed in the minds. But now, over the last 5 years especially, the whole culture changed. So corporates, insurance companies, governmental bodies, they're requesting digital health solutions now. They don't always know how to implement it because there are many challenges that you have to overcome. Speaking of which, data privacy, which is if you don't put data privacy first and you really live it, you can forget it in the European Union. Really forget it. And you really have to mean it. And for instance, it doesn't make sense to what many digital health startups are doing to have tracking pixels on our website, or to engage a lot with Facebook, have Facebook widgets on your websites where you're actually asking for symptoms. You cannot do that. For one example on how we are solving it. So for us, the patient sovereignty is part of our vision. So, which means that we want the health literacy of patients on the one hand. On the other hand, we also want them, we want to protect their privacy. So we do not want to store any personal information whatsoever. We are not asking for names, although it would make the user experience maybe more relaxed. We are not asking for email addresses, and we are not even storing IP addresses. We are not storing cookies. We don't have third parties, party widgets on our website. And you really have to be that radical for the European Union and for Austria especially. Whatever idea you might have helping patients, it's going to be naive. For the very reason that this isn't enough. Even if you're getting the tech right, it's not said that it's going to get the adoption that you want. For the simple reason that healthcare systems are so different in their setup. You really have to understand how the money flows, how the values are created, and how the values are remunerated. And this means a no-no is to not understand how the market really works and then already start suggesting solutions to it. So again, it's the same as in any market. You first have to understand it because the healthcare market is also really fragmented in other areas. Let me give you one example of a bad business model. A bad business model is if you, for a hospital, for instance, in Austria, if you offer the hospital cost efficiency at no further gains of the healthcare delivered or revenues increased, this offer is meaningless in Austria for the simple reason that hospitals in Austria are getting a flat fee, so their costs are covered. If you are reducing their costs, they're getting a smaller flat fee the next year. So you have to, this doesn't cut it. You have to really understand how the incentives are for each stakeholder. And then the difficult part is to align those interests, because your interest should be, as a digital health startup founder, that patients are going to benefit. You want to save lives. And the tricky part is, and it's an innovation on its own, it's a research, really year-long research. You have to understand on, okay, how do I convince doctors to use it? How do I convince hospitals to use it? Pharma company, insurance companies, the governmental body. Is there anyone who could say no and block everything? And then at the same time, you have to satisfy each interest, and you do not want to step on toes of anyone. and at the same time you want to actually achieve your vision of helping patients. So it's really tricky, I can tell you. So what I love about Austria is the standard of of quality of living here. So Vienna is the most livable city on earth for 7 years or 8 years in a row. But I even love more to live in the countryside. So because it's providing a deep work environment. You have only the mountains, you have lakes with drinking water quality. It's green, you have forests. You can do a lot of sports outside, and you can go climbing, canyoning, hiking, whatever. And this really provides quality of living that you won't get, for instance, in San Francisco. No way. And at the same time, the people are mostly down to earth. They are humorous. Each part of Austria has their own kind of humor. So in Vienna, the people might seem really grumpy. But yeah, so what you have to know about the Austrian healthcare system is that every citizen, every person that is living and working here is insured. And automatically. And so most of the services delivered here, like going to a GP, to a general practitioner, to your family doctor, is covered. Getting the medication, most of it is covered. So you don't have to worry about your health. If you're getting cancer and having a costly treatment, the government the insurance company is paying for it. So you're not left out in the open, which is really important because it really provides a standard of security and a living again. This also means for a digital healthcare startup that if you actually expect patients to pay, it's really difficult because they're used for getting everything for free. So there are incentives that you can make it, but it's really difficult. And it's similar in other European countries with a social security system. So our journey in Austria was quite long. So we are running a marathon. And we knew it from the beginning that this is not a quick stunt. And I mean, at first I had my hopes that, so I started Symptoma in my third year of med school. I thought by the end of my medical studies, I would have sold Symptoma and become a real doctor, like I always wanted. Like at the age of 6, I always wanted to become a doctor. But then I realized that it is such a high tech that you have to overcome so many challenges. Companies have tried to do it since the 1970s and failed at it. And I didn't want to fail, and neither did Thomas, my co-founder. So we stick to it. And how we did it, for instance, was, I mean, Thomas and we didn't pay ourselves wages until 2013, zero. Even until recently, we got the lowest hourly rates in the company, and we are 70 people now. We invested millions in Symptoma ourselves. So you really have to be here for the long run. So this also helped us in Austria. So recently I've been called a digital healthcare dinosaur in Austria. I thought I'm not that old, but yeah, regarding this industry, I'm here for quite a long time, and this helps. So it's also speaking at events and speaking to many stakeholders, it helps lending the credibility to a startup in this really complex area where healthcare is, for healthcare you need a lot of proof. And trust is the first building block. The other building blocks are scientific studies. Which is what we focus on a lot. So we have several studies and dozens of external publications about Symptoma and its accuracy. So Symptoma works like this. Patients and doctors enter symptoms and they receive a list of matching causes sorted by probability. We have invested 15 years in research and development, established the biggest disease database in the world with 20,000 conditions and billions of connections to risk factors, symptoms, and statistics. And we have achieved the highest diagnostic accuracy rates as demonstrated in internal, external, and peer-reviewed studies. For instance, Pfizer compared 107 different solutions worldwide and also concluded Symptoma to be the best one. For COVID-19, what we did was already in January 2020, so when really early on in the crisis, we just added the concept, the disease concept, COVID-19 to our database, and then Symptoma was learning from the emerging body of literature regarding COVID-19. And so it was already working for COVID-19 back then in January 2020. What we did first, before we communicated it though, was, and which is I think important for a digital healthcare startup especially, is first we looked into the science. So we really did scientific analysis. We published the results. We were transparent about all the methodology and the data that we used, and showed that, well, for COVID-19, our risk assessment had an accuracy of 96.32%. So not for the diagnosis, but for the risk assessment, and in patients with symptoms. And we proved that with more than 1,000 cases. And this also has been peer-reviewed by Nature and then also published, and which was really important because early on we were able to attract the governmental bodies that were at that time, which was in March, struggling with prioritizing the healthcare resources, namely the PCR test. So it was unclear to which patient to deliver which test. And so back then, they mainly only had a call center, so citizens were able to call this call center. But the problem was most of the patients would call this call center at the same time. You had really high peaks, and the large team were not able to cover those peaks. And in the other times, you had a lot of people sitting there and doing nothing, right, essentially. And what we provide, and citizens didn't have access. Essentially, the calls didn't go through, or they had 30 minutes of waiting time. It was unbearable. So already then in March, the city of Vienna, for instance, and others reached out in order to understand more about the studies that we have conducted and the science behind and the validation behind Symptoma. It also helped that Symptoma was a medical product class 1. According to MDD in the European Union, so it is certified as a medical product. And so all this evidence kept building up. We got a contract by the European Commission to help fighting COVID-19. We got a contract by the Austrian government to help fighting COVID-19. So this all helped, and then the city of Vienna also contracted us to help crucial organizations at risk, such as kindergartens and others, in order to tailor our solution to them. And I think, but the main achievement was rather the city of Vienna establishing Symptoma in parallel to their call centers as another way for citizens to get a risk assessment, which has the following benefits. It's easy to be accessed. You don't have a waiting time, and you have a standardized outcome. So you're getting the same questions, and you're getting a reliable, scientifically validated risk assessment, which then can lead then to, for instance, a PCR test even at home. And so there are several uniques here. So first of all, what is unique about our COVID-19 symptom checker is the following. It is not binary, so it's not saying it's COVID, yes or no. In the background, we are differentiating more than 20,000 other diseases as well. And we are saying, well, COVID-19 is not the most likely ones because there are 5 other diseases that are more likely in your case, but it is still somewhat likely. So this is the first. The second is we are able to process 100% of the patient data, which means you can enter any other symptom as well in free text. And we're still computing it and regarding it in the risk scoring. So this is unique. No one else is doing it. Thirdly, it is the first and I think still only AI that is actually doing the COVID-19 risk assessment in this way by asking for symptoms. And so the contract with the city of Vienna was quite helpful because we have now thousands of sessions linked to PCR tests. So we not only have the risk assessment of Symptoma, but we can close the loop. We know which patients had COVID-19 and which didn't. And this also led to first studies that we already published together with the city of Vienna, showing that the symptom occurrence frequency rates are completely different, such as we found out that a runny nose and sneezing were about the same. So there was no difference. So if you had sneezing, you still had the same risks for COVID-19 as when you wouldn't have sneezing, but only runny nose. And so essentially we also showed that over time and over the months, how the symptoms of the positive patients change, mainly maybe due to the mutations that were dominating the landscape here. So it's really valuable lessons. You're getting real world data when you're doing it with a digital health approach. And regarding the digital health literacy or the adoption by the citizens here, well, within 24 hours when we launched Symptoma for the city of Vienna, within 24 hours after the announcement, we have got to process, our chatbot had to process 1.5 million questions and answers, showing really that it was in high demand. And yeah, and I think the biggest success that most people don't know about is, did you know that there were no data privacy concerns? No one actually said that there are any data privacy concerns. Normally, if you have digital solutions in the healthcare space entering the market, first you're getting ripped because any data privacy weaknesses. And they couldn't find anything in our setup because Symptoma, while we were assessing the symptoms of patients, we didn't store the IP addresses and we didn't ask for the personal information. No, we only told them, the government, here's the session ID. This session ID has a high risk. And then the city of Vienna was then actually collecting your personal data in order to deliver you the test. So really, we really differentiated this setup, and we were the main driver behind that, to ensure that we as a private company do not have any personal healthcare data of the citizens. I founded my first company in 1999. Which we grew to a team size of 100. So Symptoma is our second joint company, and the first one I also co-founded with Thomas, which was in the educational space. And what we did there intuitively, we had to learn here. Because we thought that, Symptoma it's now a completely different kind of company. It's in the healthcare sector. You have to go old school. You have to get old school advisors, but no, the intuitions that we had even as students back then with our first company that's still up and running, the culture is everything, and to set up the organization in the way that you as a founder are obsolete, it's gold. And I think this was our biggest accomplishment with our first company as well. And this is also what we're striving for at Symptoma. So at Symptoma, it's also a little bit different because, our processes are certified by ISO 13485, so which is the basis for medical products if you want to certify them. And but you also, as a healthcare company here, are living through different phases. First, you're only the founders. So what is the organization structure there? Almost everyone is doing everything. And you hope to be as complementary as possible. And hopefully the skill sets of your founders are also reflecting that you have a technical founder, you have a sales-oriented founder, a product-oriented founder. You really need them all. And then, but over the time, of course, the organization changes and you have to adapt. So first you're getting away some of your tasks where you're already excelling. So whenever you're good, you have to find someone else who's better than you and overtaking your task. And then you're hitting some phases of growth pain. So 10 person company is always a growing pain for us, because then you're not so small anymore that you can communicate everything in person. It doesn't work out because you're leaving too much of the communication out of the company, and no one is going to profit from it. So there you have to adapt. And then especially with the 30 employees, you have to completely restructure the organization structure, because there's no one model. It's evolving over time. To find the best talents, you need vision, mission, culture. What you're offering is not only money. What you're offering is purpose. Like one hallmark attitude is typically that seniors are foregoing way higher wages in order to work for Symptoma. They say, I know I can get more money. It's like a like an attribute for our team members. They are foregoing higher wages and higher offers in order to work for something that has a purpose that you can live for. So because you have to imagine work as you're interacting with the society, and it is the biggest chunk of your life where you're doing that. And so work should actually, in the best case, represent some meaning for you. So otherwise, you're just doing it for the money and try to live afterwards, but you're selling your best hours. So hopefully the best hours of your day and of your week and years are worth it. And so this is the first. So the people have to understand why they are doing it and how they are going to do it. So their culture comes into place as well. In terms of, well, what are your core values? And then, yes, of course, you have to spread the word continuously, having a message that is not one day A and the other day B and then again C. It has to be consistent. People have to take you seriously, that it's not just a fluke. And I think this is especially important in Austria and in the neighboring countries in the European Union, because the culture is here quite conservative. So we are not just easily aroused and then go for it. We need the time. We need to see that you really mean it. So mostly you also, just the fact alone that you're here for 15 years, for instance, is already telling you something, because you have grit and you really mean it. And if I spend my time with you, it's not wasted, because I know what you're going to do, because you have told me your vision and mission, and everything that I do to support you is going to actually be materialized. And you're just going to shut down the company the next day and vanish. And I think for that is also important for European companies, especially, that you have to look into, you don't want to be on the tits of investors. You don't want to become a junkie of investments. For the simple reason that you are running a marathon. And sometimes the research is really difficult. Especially artificial intelligence and healthcare, it's really, really highly complex, because you have to deal with false data, with ambiguous data and missing data. It's not like in fabric or when working with other machines. You are working with organisms and with many errors and faults that you first have to sort out. So the problem there is that you have a long traction from founding until actually market access and then break even. So you need to actually have that break even early on. You have to sell any part that is already valuable to sell to customers in order to make money and to sustain yourself. You should not depend, on investments. You should, of course, go for it. But what if your project takes 10 years or 15 years, like in our case? I mean, if you had taken on investors early on, they would have fed up with us, we would have fed up with them, and the project would have died. So for the founders to be there and invest ourselves in it financially also, not only sweat equity, I think was really important. The culture in the US is fail fast. and the culture in the European Union is failure is not an option. It's just not, it's an embarrassment. You cannot fail here. It's a stigma. And I think sometimes it's good to have something like this. Why? This circumstance, this culture in Europe actually enabled us to actually make it successful, because we didn't want having so many years of unpaid work to get out and say, well, it didn't work out. No way. The culture alone would forbade us to actually leave it like that. I mean, it was also the mission and vision that it is worthwhile doing this. And this is the difference in the US. For instance, especially for symptom checkers, there have been many approaches, and they have been venture-backed in the US. So, but you got the money fast. It didn't work out, and then you failed fast. And you said, okay, let's let it go. But for especially our market, you need the grit. You need to stick out for a long time. And sometimes having investors early on is a bad thing. Not always, but sometimes it is. Of course, you need to know when the opportunity costs are getting way too high, and you have to scale fast, of course. So the type of fundings that you're typically aiming for in the European Union is, especially you should always first aim for revenues. So you should be able to cover all your expenses with revenues. And then, or at least we scale with grant money, and then comes the investments, and then somewhere down there, the marketing. So we never really focused on marketing, although people are telling me that they are already knowing our company name and such, which is an honor, of course, yeah. But we didn't really intend that. First, it's really about creating a value for patients so that we're getting also paid. Marketing, so early marketing would have been devastating for us as early investment for the same reason, because we started out in 2006. Well, imagine that we would have been really famous in 2008, and then you still need years and years in order to actually get the tech done. The technology was really, really important there. And then also the other traction, like scientific and such. So really focus on products first, on the value, and then in healthcare you have to scientifically back it up. It cannot be a standalone of just marketing text. You really have to back it up. So from my opinion, there's no difference whether you're interacting with a public or private customer. In the end, it's always the value that you're providing and the use and business cases that they have, so that there's a match and product market fit. I think especially for digital healthcare, you need the scientific backup. You need the validation as much as you have. Because those are mostly the question. And then, especially in Europe, you have to really pound hard on the data privacy aspect. And you have to be the thought leader here. So we are more radical than our customers, public and private, when it comes to data privacy, actually. If you're dealing with large organizations, you're convincing the first person who is the champion and bringing you through the organization. So you really need the champion in each organization. And then you need to know that along the way, you have to repeat yourself. You may ask yourself, I've already answered that, but put on your poker face and do it again. And just assume that they know nothing about you, which is mostly the case because they have other things to do as well. And we really take time also to understand what the decision process is. So really also ask it, okay, wonderful. So first of all, a year from now, what do you want the outcome to be? Wonderful. So if you work for 1 year, what should be the desired outcome? And then So how do we get there? So how do we get to start working with each other? So what is the process? So we have this call now. Show me the timeline and who is involved, who do we need to convince, and what could be the potential blocker? Do you already envision something that could the blocker? Do you already know someone who could be the adversary? Because you have to know that it's a pluralistic organization. So you have many different opinions. It's like not one homogeneous opinion that you're confronted with. You have different personalities, and in the end, you're always making business not with an organization, but with the people there and the individuals. And you have to take that just simply into account and understand what their individual motives are as well. So a common trap, I think, for startups is when dealing with big organizations is to fall into the pilot trap. So while you do have to do pilots, you have to do it for the right reasons. You have to understand that right now, for corporates to collaborate with startups is hot. It's a trend. You don't want to be part of this trend. You don't want to do it for marketing reasons. Although it's cool to flash a big name there and in order to elevate your product. By the way, when we are pitching, we are not mentioning any customer or any big names there, although we have many. The product should speak for itself and the value as well. But yes, when you're piloting, I think there are three different kinds of pilots. So first is the marketing aspect. Don't really get into there. You have to really do your math and assess whether it's really worthwhile. I wouldn't say it's worthwhile because if the incentives are only the marketing, it's not the content, so it's not your product, it's not your value, and you will never be able to actually demonstrate your value. It's just a nice little thing. And secondly, sometimes corporates may have an idea on how to utilize your product, although it is not meant to be utilized in this way. So they're requiring customizations and they're requiring a specific setup. If you know that this setup is not going to work, or might be, or when you have doubts that this is really actually going to show the value that your product can offer, don't lean in just because the money is on the table. It's going to hurt you, especially if you have a small target market with few players, with pharma, with insurance companies. If you're playing this game, you're burned for at least a couple of years because you will have a failed project. Although it might be their fault, in the end it is yours because you just made the deal with them. So I think the best pilot is something with a vision in terms of we know where this is going to. We want to prove that for the big numbers, it is going to pan out. Of course, yes, you want a proof point, a proof of concept. So it's not a pilot, but it's a proof of concept for your specific organization, that in your organization, our product is going to work well. And we are going to define the KPIs on how we measure success up front, and then both of us are going to work on it, because it is not a commodity. You're not going into the supermarket and buying just a bottle of juice or whatever it is and it's ready made. No, you have to also work on it as a customer, and you need to know, who am I working with? The personal connection, although regardless of the company, if you don't have a personal connection to the counterpart in the customer's organization, this product is going to fail, no matter how good you are. So there are a lot of soft skills that you also have to nail in order to be successful there.